Hello. So it has been almost exactly 24 hours since my first chemo infusion, and I wanted to kind of go over a recap quickly of what that was like and then how I'm feeling today post my first infusion. So I will say that for the couple days before, I felt like I was nesting again, just getting a bunch of things ready around in the house and cleaning and, kind of going a little crazy there. But the night before, I really didn't have any emotional or spiritual problems or concerns, and I was just really kind of anxious and just ready to get this first one over with to kind of see what it was going to be like and, just get over that first hump. And I really did. I got so many messages and text messages and notes online about people all around who are praying for us. And I think that really helped because I was just ready to do it. And we did it. So the night before, I did not sleep good. And I know a little bit now why. Part of it was, so I'm on all these medications, and some of them I had to start before chemo. Like I take one a day before, the day of, and day after, and they're steroids. And so because of that, I did keep me up. I slept from like 10 to 2-ish, and then I fed Abigail, and then I was just like wide awake until the rest of the day. I never went back to bed. And so I was pretty tired kind of going in, and then I made a mistake of not drinking coffee at home and then getting gross coffee at the hospital, which I didn't drink, and that kind of just didn't really help. But so we went to the hospital. Charlotte ended up spending the night before at my in-laws' house, so that it would just make it that much easier to getting us out of the house in the morning, be a little quicker. So we got up, well, I was already up, but we got out of the house around 6:15. We took Abigail over to my in-laws and dropped her off, and then Paul and I head up to the hospital. We got to the hospital right before 7, and my first appointment was to get my blood drawn, which is pretty typical. I'll be probably doing that almost every time, and it's in the same building. So I got my blood done. It took about 30 minutes of waiting. There were quite a few people there waiting, and then our next appointment was just on the next level or 2 levels up or something, and that was meeting with my oncologist. And this is actually only my second appointment with her, like in person. I've done a couple phone visits, but it was the second one. I hadn't seen her since August in person. And then, so she did an exam, talked about everything, how the day was gonna go. And just, kind of we caught up and made a plan. She did mention that because of my age that I might not have as severe side effects as some people who might be a little bit older. So that was kind of comforting because, that's a big thing. You just don't know how you're going to feel. And that was comforting. And then also when she went ahead and like felt the mass, and she kind of was surprised. She thinks it's already getting smaller just because of my pregnancy hormones kind of like decreasing. That's a good thing. But we did ask like, oh, does that change anything? And she said, no, it doesn't change the course of any kind of treatment, but it is like encouraging to see. And it's a possibility that, really this chemo and what we're doing right now is the best treatment plan. And it's just going to knock all the cancer out of my body, which is awesome. We went over my CT results. There's just one area of concern, but she's not too concerned. And especially with this, we're going to do another scan again when chemo's over to kind of look at that spot. And it happens to be like in my pelvic bone. So it's like up in the bone, in the back. And, but she's not too concerned, and she thinks that it's just going to be gone when we do the scan again because the chemo will target that area if it is an area of concern, or it could just be like a false positive. Something that just lit up that possibly shouldn't have or something. She's really not concerned, so that was nice. Okay, so that took us to about 8:15. 8:30. We had about 15-20 minutes before my appointment was scheduled in the infusion. So we ran and got a bagel, and that's when we got that gross coffee. It was so bad. And then talked with Paul, sat with him for a little bit because he wasn't allowed to go back in the infusion with me. That's the only spot in the hospital he's not allowed. Our doctor misspoke a couple weeks ago, so we had our hopes up, but we knew this was coming. So said my goodbye to him, and then they took me back to get the infusion. And it was a little different than I imagined. I don't know, I've only really seen like stuff on TV and movies and everything, and so I don't know, I thought it was gonna be like more glamorous or like comfy, but it was very medical, like you'd expect, and that's actually what's needed, you know. And I was in like a room. It was like a long skinny hallway kind of that was like blocked off, and I was right by the nurse's station, and I had a very nice nurse. And I was in like a chair room, and there's two, like in like this room with just curtains on the outside, there's like 2 chairs. For the majority of it I was there alone, but then later on another patient did come by and sat in the other chair, but they had like a curtain and it's like more private. They had some room with beds, I think, for older patients or if you're having certain types of medication done. And I got everything. So the first thing he did was gave me like 2 or 3 different kind of medications for side effects, mostly nausea, and those were done through an IV. The IV was funny. I think I like made her a little nervous because I'm trying to decide between if I want a port or not, and I like kind of told her that, and I said that, you know, I just had a baby and they took them like 3 tries to give me my IV. And so I was like, I just, you know, if you think a port's a good idea, I'm open to it, but I only have 6 rounds and I don't want to get poked a bunch. So I made her kind of nervous, and she ended up getting the ultrasound, or like the special light to see my veins, and she got it on the first try and there was no problems. It just kind of took a little bit, and again, I think she said it was fine, but I think I made her a little nervous. So I got that in, no problems with that, and then got my medications first. And then part of my treatment plan is getting these injections. They could be IVs, but I opted for injections so that, because I'm gonna be doing them for a year, and it shortens the time that I'm sitting at the hospital. Like instead of, it's like an 8-minute injection. It takes 8 minutes to give instead of like 30 minutes to an hour of an IV, you know, going really slowly. And this is the injection that I'm going to be getting for every 3 weeks for a year, and it is the one that targets that HER2 portion of my cancer, and so it's really helpful. And I asked the oncologist the possibility, you know, after my chemo is done in June, I could be getting these injections at home. That's what I prefer, instead of going to the hospital, but we'll just kind of see what it's like then. So I got that, and she tried to give it in my stomach, but she ended up opting to go in my thigh. She started in the stomach, and it's like a really, really thick, little tiny needle, but a really, really thick mixture of this medicine that she really has to like put pressure on over 8 minutes, just like a timer going, and you have to inject it over 8 minutes. And so the stomach, it just wasn't taking very well, and it kind of left a red mark, and so she went to my thigh, and it like, took it a lot better. So after that, they hooked me up to my first medication, and this time it did take a little bit longer. The rest of them will go quicker. And that was took about 2-ish hours of an IV with that. And so the first kind of time I was left alone for a little bit, which is kind of nice. I did some reading and texting. I had so many wonderful people reach out, and just seeing how I was doing. That was nice. And I was able to like get up and use the restroom if I needed. I to bring my IVs and everything with me on a roller, and I was able to eat. I brought some snacks. And then after that first injection, then it was time for the second one, which only took a half hour. And then after that, I got this fancy little patch that they put on me. So I'm going to be getting this after every infusion, and I wear it for around 27 hours after it's done. So I ended around, my infusion started around 8:45, and I was done right at 1 o'clock. So a little over 4 hours. And again, they'll be slightly smaller, that portion. We were at the hospital for 7 hours. It was a long day. But after every 3 weeks when I have my infusion, I'll wear this. And around 4 o'clock today, 27 hours after your injection, this is going to start beeping, and it is going to inject me with some medication. And this is helpful. Now I don't have to go back to the hospital today. And you know, my first couple times Paul's going to be around. It takes 45 minutes for the injection. So from 4 o'clock to like 4:45, Paul's just going to kind of hang out with me, make sure I don't have any reactions or nothing funky happens. And then we have instructions, but then you just take it out. It already poked me. It lights up sometimes. It already poked me at the hospital, and then like put like a little catheter for the medication, so there's not a needle in me right now. It's just more of like a plastic thing, I think. I don't know. No problems. It's not uncomfortable. It doesn't hurt. I just have to kind of get used to. For some reason, I walk really close to walls when I go through doorways, and I like keep scraping it. And you know, of course, we don't want it to leak or come off. And I just sleep on my right side, which I normally do. my right side down so that I didn't like, you know, make it uncomfortable or anything. And I kind of been wearing long sleeves all day. I just now put on short sleeves. So that will happen. So yesterday was fine. I felt fine. I did get really sleepy towards the end, and I think that was a couple of things. First of all, I'm a new mom, and I was able to like sit down in one spot for 4 hours. And then at the end, they gave me like this 10-minute video to watch about this, and that just put me to sleep. I didn't go to sleep. I was so tired. She told me I could sleep. I just couldn't do it. And then also, you know, just the culmination of all this like waiting for this chemo day to happen, and then it finally came, you know. I think that was just kind of like an emotional roller coaster, and then it's like crashed and tiredness. And then obviously all these medications, like the number one thing is exhaustion. Not the number one thing, but a side effect is exhaustion and tiredness. And so I was very tired. When I FaceTimed Paul, he was like, "Are you okay?" And I'm like, "Yeah, I'm just really tired." And so the way home, we grabbed some food, and then we went home and ate, and then I just couldn't even like wait to finish we got tropical smoothie, and we came home. I just couldn't wait to finish my sandwich and just go lay down, and that's exactly what I did. I went and I laid down, and I slept for a couple hours. Then I woke up, and then Paul said he's gonna go pick up the girls from Dan and Lisa's, so I kept sleeping until I got home, and I got, I don't know, like 3 or 4 hour nap in, and I felt better, but I was still just really tired. I've also been drinking tons of water. If you don't know the story behind this water bottle, it's kind of funny. I got this for Christmas, and actually ordered double the size. This is a half gallon, and I accidentally ordered a 1 gallon, and it was so big, and this is still huge too. But I got this for like pregnancy and breastfeeding, not even knowing about the chemo. But hydration is super important with chemotherapy, you know, especially the week after. And so I've been like drinking this yesterday and today, and more than just this. Like I'll fill this up or use some other water bottles too. But I've been trying to hydrate like crazy. And then I don't really have an appetite right now, but I'm eating like the small meals. And so I'm still pretty tired. I'm starting to feel a little better now. Last night, Paul was so sweet and let me sleep like almost all night. I mean, I woke up a couple times, but he slept in the baby's room on the floor because she's a noisy sleeper, and she's normally in our room, and he wanted just to be by her, and he took her night feedings. And if she was in our room, I would have just woke up a lot because I would have heard her grunting and snoring, and she's a noisy sleeper at nighttime. And so that was so nice. I got like a lot of sleep last night, and I got up around 7, I think, today. And Paul's been working on and off, but he's like very available to come up and help. And a little grumpy, I would say, but I'm handling it. I just have like a shorter patience, and I really think it's just because I'm just exhausted. And then yeah, so really just tiredness is the biggest one. My stomach feels weird. I'm gonna have a lot of digestion problems over the next year. That's one of the big side effects, so I'm not looking forward to that. But I don't really think I feel nauseous. Sometimes I can't tell if it's my stomach, if I'm nauseous, or if I'm hungry. And so I don't know, I just feel off, but it's like super tolerable right now, you know, for a day 2. I have lots of medications that I can take if anything gets bad, but I haven't needed to take any of like the extra ones. I'm just taking the ones that they like want me to take daily, and I'm just trying to take it easy. So that is day 1.5. Here in a minute or an hour, so I get to take a shower. Yeah, I can't shower with this on either, and so I showered because we had an early morning. I showered Monday night. Now it's Wednesday, so like I just kind of want to shower. I showered Monday night, and then you know, it'd be nice to get in the shower, take a hot shower around 5 o'clock today. But it's a really nice day out. I should go outside. I don't know. We'll see what I do. So I plan on merging this with like another update tomorrow, if anything changes, and then I'll probably post this at the end of the week. But that's how I'm feeling. Oh, the only other thing is that it kind of went down. I don't have any makeup on right now, but I was super flushed this morning. Like my cheeks were just like really red, and that's normal, I think. I didn't feel warm or anything. I just had really, really red cheeks, but they've already come down. I took a picture. They already did come down quite a bit, so that's good. Yeah, that is everything that I can think of. Thank you. So a quick update about how today's going. Today's Thursday, and it's been a weird day. I'm holding Abby here if you hear anything, holding the baby. But I don't know, this morning I felt pretty good. I got some sleep last night. I took a couple feedings. I had energy right before bed last night, which felt good. And then, yeah, this morning I woke up and I don't know. My mind is just very foggy today and it's hard to focus. My face is still a little flush. I don't know if you could tell on camera. I took a shower. That was nice. We did have Charlotte go over to her grandma's house so that it could just be a quieter day, and I'm really thankful for that because this afternoon it was really hard on me. I mean, it's only 3:40 right now, but I was just having a hard time with keeping up with Abby and getting her down, and I got a really bad headache, and it's just hard to focus. And I don't know, I'm struggling with trying to do too much, or like seeing something I want to do, like fold a basket of laundry, but I don't know. It just takes a lot out of me. I got a really bad headache because I took some Motrin this afternoon, and kind of all culminated with some stressful moment where I couldn't get Abby back to sleep because she was a little overtired, and I had an awful headache, and I needed to like look up if I'm allowed to have a headache and what kind I can take, because there's a lot of like side effect stuff. I like all these lists that I just have to, it's just hard to keep track of, and I don't know. Anyway, so Paul, he's been able to be flexible with his work. He's able to come up and help her, and I took my medicine and then just went and like crashed for an hour, and that was the best thing for me to do, even though I wanted to like, I don't know, I'm really obsessed today about making some breakfast freezer meals, and I like can't get that out of my mind because I bought all these eggs, but like I just don't have the energy to do that or the time when you're taking care of a baby. I don't know, hope that makes sense, but it's just a weird day, and I'm hoping I get a little bit more time to do something. I don't know. We're going to talk about this thing called chemo brain, apparently, that I'm experiencing really heavily today and yesterday, and it's really frustrating. And I just can't like focus on little things. And I'm having a hard time like texting and like remembering when I'm texting or writing things, or just like remembering the space key when I'm texting. And right now it's just really difficult because Paul is picking up a Meijer pickup order, and I'm also talking to the shopper, and also trying to get Paul to get me some coffee, which he's doing, but I just had to like communicate, and just like all of that was just too much. And then I get all these notifications on my phone, and I'm like, I just can't keep things straight. It's really strange. I mean, it could be worse. A lot of things could be worse, but my brain just feels really foggy, and it's hard to focus on like the task that I'm doing. That's really difficult. I feel today's Friday, by the way. I feel okay today. Yesterday was rough. Last night was rough. This morning was okay. Charlotte is not here today, and I feel bad because when she's around, it's just like, you know, she's 2 and she has lots of questions and lots of things she says over and over, and like I just can't, like even just before breakfast, like focus on her because she's like saying the same thing over and over, and it's just too much for my brain right now. It's just like I guess you could describe it as like overstimulating in a way, and yeah, it's just strange. I don't know if I'll post this. I don't know if it makes any sense. This is like literally again my 4th time recording this short video, and I don't know. Anyways, that's what's going on right now. Okay, so it's Saturday afternoon. Kids are kind of napping. Paul's downstairs. I just needed a couple minutes to record this. Today's been another hard day. I think it's hard because, like, obviously I don't feel good. Like, that's obvious. I'm tired. I have, like, today and the weekends, this weekend, like, I've started, like, really bad stomach problems, which is, like, part of the chemotherapy that I'm on. And then, like I just have like a really bad headache and just exhausted and like cloggy brain, and my mouth hurts, and like I just randomly have pains, and like I'm just unhappy. And it's hard. And it's hard because I was talking to Paul. It's hard because like life still goes on, and like we still have kids that we have to take care of, and like I'm not just pausing life so I can be sick. And like I kind of want to, in a way, pause everything so I can like just be sick and then like pick everything back up. But I have a 1-month-old that we're taking care of, and I don't want her to go anywhere else. Like it's not like we have help we could get or people here, but like I just want her to be here and Charlotte to be here. And I do have like moments of really good, like I feel really good. And so during the moments I've been trying to use them to like take care of Charlotte. Or like last night I felt good right before bed, so I put her to bed and gave her a bath. And this morning I felt okay, so I fed Abby at like 5 a.m. But then there'll just be moments where like I just get really overwhelmed and I just don't feel good. I just feel awful. And it's not fun at all. And I'm just praying that it goes away soon and I can just have like a couple weeks of feeling normal before I have to do this again. I don't want to do this again. This is really hard, but it is what it is. And I've been like writing down truths that are like real, like biblical truths when I like come across them. And my first two I wrote down earlier this week says, my situation is filled with uncertainty. It is very serious, but it's perfectly right. I had a friend remind me of that this week, that God just gives us what's right. And I don't understand how this could be right in my life right now, but it is. And also that God will deliver me and impart a lesson I will never forget. I don't know where that lesson is. I'm looking for it. I'm just gonna try to learn from it. I think there's a lot I'm learning about patience. And then I also did a devotion about being like a stewardship, being a steward of your suffering. And so like not just allowing the suffering to pass, but like just like taking, like accepting it and whatever it means for you, if that makes sense. I still have a little bit of a cloggy mind, so not everything makes sense, but yeah, so that's how I'm feeling. Kind of down, pretty down. I just hope I just feel better. Everything is not fun right now. Okay, so it is Sunday morning and I'm in bed. That was a really rough night. I felt pretty good last night, Saturday night, and I thought I was like on the mend and doing good. But some new symptoms started up last night, all night long, and so it was really rough. And it's unfortunate because it's like digestive stuff that is because of one of the medications I'm on, my injections that I'm going to be getting for a year. This is a side effect from that, and they said it would probably start on the weekend, but I never have digestive problems like ever. So I was really hoping that I could just get away with not having any and at all. But anyways, I'm on this injection for a year, and so I'm just really praying that this doesn't hit me this hard every 3 weeks for a year, because this is not fun. I did kind of pass a threshold this morning where I have like a list of when you need to call. The doctor is on call, and I passed that threshold this morning, and so I did have to call and kind of explain what's going on, and they made a plan. And mostly at this point they're just worried about dehydration, and so I just have to make sure I'm staying hydrated, which I'm trying, and eating. I just don't feel like it right now. And so yeah, but Paul ran and got me some like Gatorade and crackers and stuff this morning from the gas station. It just hit all of a sudden really hard. But now I'm taking a little nap, and then hopefully I'll feel a little better soon. Sunday update. Good morning. It is Monday at 5 a.m. I'm feeding Abigail here, and this is the first day that I felt very normal. So I'm thinking that I'm done with, it's been almost a week now since my first chemo treatment, and I'm thinking that I'm finally done with all the weird side effects for now until the next one. So yesterday was pretty crazy though. I did record when I wasn't feeling good and about my stomach issues, but things changed after that, and I kept having more and more stomach issues, and I had to call the doctor again, and they gave me some medicine to take, and then they called back and they changed their mind, and they kind of said, all right, if you don't get better within a couple hours, they were gonna make me go to the emergency room because they were worried about dehydration, and also they wanted to rule out that this wasn't an infection and not a side effect. So it was weird because I was just starting to feel good, and I mentally was there, just my body wasn't there. And so that was around 3 o'clock yesterday afternoon, and amazing power of prayer, we asked a couple people to pray specifically about this, and that I wouldn't have to go to the hospital, and that my body would stop being sick. And it worked. It's amazing. God's wonderful. I was able to not be sick, and I'm good now, and I'm hydrating. I lost 5 pounds in less than 12 hours. I was really sick. I didn't eat much yesterday, but so today I'm gonna be making sure that I slowly build my appetite back up and stay hydrated and continue watching things. But I feel with it today for the first time, and it's amazing. I'm gonna have a good day. Excited. A good start to the week, and it's gonna be 60 degrees outside, so I'm very excited for the weather. Thank you guys, thank everyone for your prayer and your support, and yeah, that's it.